Hello, QLS family, and welcome to this week's video. Well, if there's one thing we can say about our COVID journey, is that it sure has had some twists and turns. All along, we have made it our mission to be transparent with you, our residents, families, and communities every step of the way, even if it was to tell you that we just didn't have all the answers yet. As you're probably aware, this week we learned that we must perform universal testing of both staff and residents. Today, we're going to attempt to answer some of the questions we've most commonly been asked about that.
Why do I have to be tested now?
On Monday, June 8th, Pennsylvania Secretary of Health, Dr. Rachel Levine, announced that universal testing for the novel coronavirus is now required of all Pennsylvania nursing homes. The order requires nursing homes to test all residents and staff for COVID-19 by no later than July 24th.
Why weren't we tested sooner?
There have been many discussions regarding testing since the COVID-19 pandemic began. While some believe that testing is a good way to stop an outbreak from occurring in a facility, others were concerned about the rate of false positives that have been reported where widespread testing has occurred. We also recognize that a negative test result today doesn't mean COVID won't enter the facility tomorrow. Instead, QLS has tested all residents with suspected COVID and potential COVID symptoms and have not had any positive results. We've also encouraged all COVID-19 symptomatic and/or potentially exposed employees to get tested and have not permitted them to return to the facility until a negative test result was produced or they were no longer considered contagious.
When will I be tested?
Every employee that works in a QLS facility must be tested by July 24th. We are currently working on a schedule for both residents and staff to be tested over the coming weeks. As soon as a date has been determined for your location, a flyer and sign-up sheet will be posted for you to schedule your testing time slot.
Who will be conducting the tests, and will it hurt?
Most people report that having the nasal swab test is not painful. The most common word used to describe it is uncomfortable. The clinical services team and other trained and qualified licensed nurses from QLS Butler and Quality Medical Associates will conduct the test on the original test day. Makeup tests must be performed by a trained and licensed nurse within the facility.
What happens if I'm not scheduled to work the day the test is taken?
All employees are strongly encouraged to receive their test on the scheduled test date, if at all possible. Employees who are unable to test on the scheduled test date must arrange to be tested prior to reporting for their next shift. For instance, if you are out of town on your facility's scheduled test date, you will need to contact your supervisor to make arrangements to test prior to reporting to work when you return.
How soon will I know my test results once I'm tested?
Results should be available in 48 to 72 hours after the test has been conducted. The lab company with whom the company is contracted has given facilities secure access to a portal containing the test results. In the unlikely case that an employee tests positive, they will be notified immediately. Anyone with whom they may have had contact will also be notified. No other medical information will be gathered during the test. However, test results must be reported to the state and federal government.
Who's paying for my test?
Employees will not be required to pay anything for their testing. The state has not been particularly clear about who will be paying for the mandated employee and resident tests. Our assumption is that stimulus funds received by long-term care facilities are expected to be used for COVID-related expenses, including testing, PPE, cleaning, and sanitation products, etc.
What happens if I test positive?
If you test positive for COVID-19 during the state-mandated universal testing policy, you will be required to quarantine at home, seek medical treatment if necessary, or work on a COVID unit within the facility, depending on the risk of exposure, community spread, and staffing needs at that time. If you are not needed on a COVID unit and you're required to be off work, you will receive 2/3 of your hourly base pay until you're able to safely return, usually 10 to 14 days. Although we are not required to pay for time off due to a positive test result, and many of our competitors have chosen not to, we have chosen to provide compensation similar to that of which you would receive on workers' comp, unemployment, or disability.
What if I refuse to be tested?
While we certainly can't force anyone to receive a test that they don't want to receive due to the state mandate, we are hopeful that everyone agrees to be tested. If an employee does refuse testing, they will be required to quarantine at home or work on a COVID unit within the facility, depending on the risk of exposure, community spread, and staffing needs. Unlike a positive test result, employees who refuse a test will not receive compensation for time off work. These have been great questions, and we know this may not answer every question that you have, but we hope it answered most of them. We are still working out some of the details, but we feel confident that we will all rise to this challenge the way we have with every COVID challenge we faced. We are so proud of the way that you have each protected your residents, patients, and coworkers, and we're hopeful that this universal testing will just serve as confirmation and reassurance that your vigilance has paid off. May God bless you and keep you and your family safe and healthy. Until next week, goodbye.